honored as heroes.
And because nobody else wanted to and because she loved her job, she chose to go ahead and work on the COVID floor.
Nurses, doctors, and paramedics on the front lines of the pandemic. And some, like phlebotomist Lily Sosi, gave their lives.
I just don't think it's fair sometimes. I don't think that it's fair that she was taken from us.
Healthcare workers are fighting for their safety in many ways. One worker at a clinic told police a patient coughed in her face after she asked her to put on a mask. That woman now faces battery charges.
Like, I've been swung at, people have tried to kick me.
Target 7 looked through court records in Bernalillo County and found 90 felony assaults on healthcare workers since 2020. Now, if you compare that to before the pandemic, the numbers are about the same, but attacks are much more violent. We found cases in which healthcare workers were bitten, headbutted, and sexually assaulted.
But with COVID, I think that there's less resources, there's less staff, because I think that people are constantly overwhelmed with the job.
Erin Riemann is an emergency room nurse.
I know that when I'm in a patient's room, I will never let the patient come between me and the door.
I think a lot of people have kind of gone off their rocker.
That's Aaron Jones. His private security company is staffed with ex-police officers.
There's a lot of places before that would not allow armed security in them, and that has evolved.
This is video of his guards on patrol. Many now protect workers at ERs, urgent care clinics, and nursing homes.
People know that if we're there or people like us are there, that they're going to get met with resistance and they've got to behave.
Attacking a healthcare worker is a serious crime.
The penalties get pretty severe once you get past, let's say, a misdemeanor level. For example, it's a third-degree felony to batter a healthcare worker.
If you're convicted, you could end up at a place like this, the Penitentiary of New Mexico complex in Santa Fe. There's even a special law that could give you more prison time if you're convicted. But our investigation found that more times than not, those accused of assaulting healthcare workers don't even end up at a place like this. The reason?
I think by the time they actually followed through with the case, it had already been like a year, and she's like, I don't remember like exactly what happened. Like, I don't remember what I charted.
Riemann says many of her co-workers who have been attacked haven't followed through because prosecution is a big time commitment.
We have so many roadblocks along the way that victims get tired and stop participating.
Adolfo Mendez with the district attorney's office says in Bernalillo County, the courts require victims to show up for nearly every hearing. It means dozens of appointments, and if they miss just one, the case gets thrown out.
There are several layers where victims' participation is needed.
The DA's office is currently lobbying for changes to be made so that victims don't have to show up to every single court appearance. But for now, you could expect armed guards to protect those on the front lines of COVID-19.
But they can't always be right there. You just kind of have to look after your own best interest.
For Target 7, I'm John Cardinelli.
According to court documents, mental illness is also a reason many of these cases do not go to trial.